Tranexamic acid is a synthetic lysine analog that reduces bleeding by inhibiting fibrinolysis. It's widely used in total hip arthroplasty, yet dosing remains variable, largely because previous studies have relied on surrogate clinical endpoints rather than biological targets. The Oracle study was designed to address this gap. Our aim was to define optimal intravenous tranexamic acid dosing using an in vivo population PK/PD approach in adults undergoing total hip arthroplasty. Participants received 15 mg per kilogram of intravenous tranexamic acid administered 30 minutes before surgery. Serial blood samples were collected and a nonlinear mixed effects model was developed. The PK/PD target was based on 90% inhibition of fibrinolysis derived from clot lysis assays. 24 patients were enrolled. Clot lysis assays demonstrated marked inhibition at skin incision and closure, partial inhibition at 6 hours, and restoration to baseline fibrinolysis by 24 hours. A three-compartment model provided the best fit. Tranexamic acid concentration of 10 milligrams per liter was selected as the therapeutic target. Additional fibrinolytic markers were measured to contextualize the primary findings. Monte Carlo simulations showed that neither single nor repeated bolus dosing sustained the PK/PD target to 24 hours across a range of renal function. In contrast, over 90% of the patients achieved sustained target inhibition when a 15 mg per kilogram bolus was followed by an infusion for 24 hours, which is our recommended regimen. Key strengths of Oracle include its in vivo design, use of fibrinolysis as the endpoint, and the simultaneous assessment of pharmacokinetics and pharmacodynamics. However, limited generalizability, practical implementation, and the absence of clinical effectiveness and safety outcomes should be considered. Thanks for taking the time to explore this work. We hope you enjoy reading this article.